Hello.
Ooh.
I've got some questions. Would that be all right with you?
Yeah, let's do it, yeah.
Oh, lovely. So the first one is from a lady called Caroline. She's got a 5-year-old little boy who's super, super shy at school, but he's sort of really advanced at home. So she's looking for tips on building his confidence outside of the home. When he's reading at school, they said that he's shy, he doesn't read very well, but she knows at home, she's looked it up, and he's reading sort of 2 years beyond his sort of where he should be. And she just wishes he had the confidence outside of the home that he has inside. What would you say to Caroline?
I think, so clearly there's like an environmental problem, isn't there? So it's not that he doesn't know how to do it, he clearly does know how to do it, but there's something about the school environment that's putting him off, basically. And I think sometimes it's about really getting to grips with what it is. So for example, like can be things like, if it's sort of an attentional problem, obviously sometimes easier to concentrate at home because it's just you and your parent and, you know, you're reading, but actually in school, lots of things. I mean, he is 5 and 5-year-olds still have sort of, it's easy for them to lose their attention on something else. So it might be that at home, it's just the environment is really kind of perfect for him to focus, whereas at school, there's just, you know, lots of kids around, busy classroom, that kind of thing. Or it could be something like very specific about the environment as well. I mean, I'd be really interested to hear about whether he's generally shy, like with, I don't know, grandparents, aunts and uncles, you know, or extended family, whether shyness is a problem like just kind of extended past, you know, the home, or whether it's just very specific to school. Because I guess that's kind of what you want to think about, is you sort of want to locate the difficulty. And the more you can locate it, the easier it becomes to think, well, what is it that's going on? Is it shyness? Or is it that, you know, the way things are at school doesn't quite work for him specifically, because maybe, you know, he just needs a bit longer to get used to having all that stimuli around, you know, with noise and kids and things like that. So I think confidence is one of those things where usually you just need to find what it is that's decreasing the confidence rather than necessarily increasing the confidence. I mean, he might have a teacher, I don't know, who he's really scared of or something, and younger kids do, you know, it is tricky for them. I think for me, the tip I always give parents for, you know, if you have a small child who's at home seems fine, but the minute you're outside, they basically just clam up, you know, and don't want to interact, is don't speak for them. Really hard. So you get into this habit of speaking for your child, because obviously when they're little you do, and then, you know, as you get older and they're very shy, you just, you know, you step in wanting to help them out. But basically the more you do that, the more they get used to the fact they don't really need to speak. So it just becomes like a self-fulfilling prophecy. So it's a bit tricky because it will feel a bit uncomfortable. But I think that's kind of, it's, you know, obviously we're not all going out at the moment, are we? But if you were going out and, you know, like what's on the menu, ordering something, let them say what they want, let them just say those little things. It can be just really tiny things to start off with. But instead of just automatically ordering for them or, you know, saying stuff for them.
Yeah, that's really interesting. I suppose I have the opposite problem with my 7-year-old in that if I go into a restaurant, she is misconfident. She'll go straight to the waiter. Can I have a menu? Can I have some crayons, please? Can I have this? And to the point where you're like, no, actually, it's a bit rude. He's in the middle of something. You know, he's serving the table next to them. What would you say to somebody in that position?
Certainly, I think what's nice when they're about 7 is that you can start to have the conversations about sort of more nuanced social behaviour. So obviously when they're little, you're just sort of putting some basic kind of rules in about, you know, what is and isn't okay. But I think when they're getting to that age and they're about sort of 7 and 8 and 9, you can start to think with them, how will it look from the outside when they are kind of quite so confident. And I think for me, it's almost like you have a bit of a debrief afterwards. So if I went out with my daughter and she was, you know, really in your face somewhere, I'd probably afterwards say, you know, that was probably just a bit too much. And usually when people are a bit older, you know, when you're little, you might be like that. But when you're a bit older, you say this, or you do it in a slightly more toned down way, and you kind of give us some examples of things to try next time we do this. So kind of almost a bit like coaching.
So don't deal with it there and then, because that's what you don't want, is it?
It's quite embarrassing, isn't it, for the child then, isn't it? If you're doing it right there and then, it's a bit, and also like they're having you go at having a social interaction with an adult they don't know, which, is a good thing intrinsically. And you're just trying to fine tune that interaction to make sure it's not like overwhelming. But I mean, that's okay. That's the whole point of growing up, isn't it? You're just giving them a bit of feedback and a bit of coaching in the way that you would anywhere else.
Yeah, just on the walk home or whatever, then just mention it then. I like that, thank you. So I hope that helps Caroline. Kate has a 3-year-old, and she's really, her 3-year-old Harry is really sort of pushing boundaries, and I can completely empathise because obviously I've got a 3-year-old as well. And she says she doesn't want to be on his case all the time, but should she decide which things to let go and which things to correct, or should she be correcting and explaining everything?
So I think this is somewhere like where, because obviously you can have endless battles with a 3-year-old, can't you? Like you could be telling them what to do all day, every day, and correcting them constantly, couldn't you, if you wanted to? Because I guess that's the age they're really testing a lot of boundaries. That's kind of the whole point at that time. So I think for every parent is a bit different. There'll be some things that they feel very, very strongly about, like maybe, I don't know, aggression, for example, like, if they're hitting people or biting or nipping, that kind of thing. Like some things are probably a complete, this should just absolutely never happen. Some things are probably, okay, there's some rules around this, but it's not maybe quite as strict. And some things are like, I'm not even going to think about that right now. I'll think about that, later. And I think it would be really nice to kind of almost divide them up into those 3 categories. Just think about all the different behaviours that go on, because, they tend to be the same kinds of things. And say, okay, which are the have 2 in the kind of really this is not okay category at the most. Have 3 or so in the middle category, and then the rest just, put to one side and say, I'll deal with that later. And I think for me, the things that tend to go in the kind of should never happen is a kind of long-term value stuff, like, as I said, like aggression, or like things about being honest, or, kind of more in-depth stuff, really. Or things that might make life very difficult for parents, like, if your 3-year-old is constantly drawing on the walls or something, and it means you have to repaint the room, every few days. It's kind of things that might be really affecting how you're living. And I guess I'd only put a couple of things in there, because if you put 10 things in there, you would just constantly be fighting with your child. So, and it will probably be different for different parents, but certainly for me, for example, violence was never going to be okay. So I always had that kind of conversation, because any other hitting or anything, I'd be like, nope. But there were other things that, were kind of a bit like, not that fussed about that.
Yeah, I think you're right. My house is definitely honesty. So if they lie, that's a big red flag for me. Isabella's doing it all the time, taking my phone, and then I'll say, have you got my phone? And she said, no. That's a big red flag. Yeah. And like you say, hitting and any sort of violence towards each other.
And I think with other things, obviously 3-year-olds have very limited capacity to inhibit themselves, and they'll do whatever comes to their mind, because that's quite normal for them. And I think it's also not letting them have the opportunity as much, for example. So I know, for me, my phone was completely out of bounds. In fact, it's still out of bounds to my daughter now. My phone does not get used. I know plenty of parents feel very comfortable about that, and they kids do random stuff on their phone and send random messages to people, and that's up to them. But for me, rather than kind of having that argument over and over again, it was never really available to her to grab off a table. It was always somewhere physically out of bounds. So I think some boundaries you can put in without arguing, rather than just removing whatever it is that's difficult. If your child is drawing on the walls with crayons, well, you put the crayons away and they're not accessible.
Yes.
And then you don't have that argument. It only gets done supervised way. So it's thinking about those things as well.
I've done this one with my makeup bag. It's on the highest shelf that can't be reached, because otherwise my children come out fully made up in the morning. Have you got any tips for anybody on sharing time out when you've got more than one child?
Yeah, I saw that question. I think it's really difficult, because I would always advise parents that it is kind of done. I think each child does need some of their own time. Obviously, the more you have, the harder it comes to have any separate time. So I think probably what kind of is a good combination is that you have some planned time together as, you know, with your kids, with all of them, however many there are. But you do have some, maybe depending on how many you have, not every day, like separate time with each one, like on different days maybe, or kind of, but it's predictable, because I think for kids, everything's about being predictable. And, you know, if children know, like if, I don't know, you've got 3 kids or something, and they know that, you know, one of them has these bedtimes with mum, and one of them has these bedtimes with dad, and it gets, you know, like there's certain days you do it on, is the knowing it, they can kind of get to the next bit of when they're going to have parent time if they know when it's coming. Whereas I think what tends to go wrong sometimes is when there isn't, it's not predictable.
Yeah, so it's about, I suppose it's about being organised then and being planning ahead.
I'm a great fan of trying to plan things in, because it just makes life, I mean, parenting life's quite tough anyway. So if it's one less thing that I don't have to do, and it also means that I know that time is free, and my daughter knows that time is free for her. Whereas if they're kind of having to joust for your time and fight for your time because you're always busy with one of them or busy with other things, then it's tricky. And it doesn't have to be long, it can be like 10 minutes, you know, it can be like watching a couple of YouTube videos with them, or, you know, playing a quick game of dominoes or something, you know, like it can be something really small. It doesn't have to be spend, you know, an hour with them or something. But as long as it's like it's predictable and they know it's coming, then I think that's what really helps.
Chris has a 3-year-old who says he's a very, very busy little boy, but how can you help build their ability to concentrate for any length of time? I put Rosie in preschool with this one because I saw this happening with her. I was like, she's into everything. I think she's really intelligent, but someone needs to harness it, because she will not pay attention to any one thing for particularly long. So yeah, what advice would you give to somebody in that predicament, and how can we lengthen that time?
This is the one kind of thing that it helps if you know, and to not really think about it, because basically, so there's levels of attention that kids acquire as they get older, and at 3, you wouldn't expect, like no normal child would have any attention really. Like it's really quite normal, and it's one of the reasons, like for example, things like, you know, ADHD never ever get diagnosed. Really, I mean, under the age of 6 is tricky. I mean, some kids get it slightly younger, because it's completely normal to essentially look like a totally hyperactive kid with no attention. And then sort of by the age of 4 and 5, they start to develop slightly more, you know, like task-orientated attention and that kind of thing. But certainly at the age of 3, it's really fairly normal to be scattering your attention, you know, about on different things. And it doesn't mean that they won't acquire the attention at a later date. It's just the normal sort of phase of development, really. Very tricky one for parents.
Yeah. It's good to know. It's really reassuring that you say don't worry about it at the moment, and we can just.
And then, I guess, like if you think about children's brains, there's some things they just can't do yet. I mean, there's some things that 7-year-old brains can't do yet, and it doesn't matter like how much you try and get them to do it, they just kind of can't do it. You know, you're not kind of even there yet. At 3, you're just, your brain's just like, oh, this and this and this and this and this.
Okay, thank you for that. So I've had a message from somebody whose little girl starts preschool this September. Now she asks, how should she approach worries or anxieties that her child comes out with, and that's sort of before, in the run-up to her going to school, to preschool, and also in those first few days of her being at preschool.
To be honest, at that time they're only just getting to kind of be with kids and start interacting with other kids. And I think what's probably most important is that the parent's okay, because it causes kids so much feed off for anxiety, don't they, and our kind of worries. I don't know. I think it might be helpful to notice with them what feelings they're having. So like, I'd probably have a conversation around like, do you feel, you know, what do you feel? Does it feel a bit funny? Do you feel a bit excited? Do you feel a bit scared? Is it a combination of the two? Kind of, they might not really be able to identify that yet, because I think it's quite advanced in many ways. But you can certainly ask and say like, are you, worried or scared? And if they are, just to say, yeah, it's quite normal. Like, I get worried and scared when I start something new, and kind of normalize that. And I'd probably really do that more as a sort of kind of emotional development type, exercise, rather than expecting them to really know exactly what they're feeling, but just sort of helping them think that they might be having those feelings before starting something new. But I think at that age, kids aren't thinking very far in advance into the future. They're kind of much more in the present, the day by day sort of stuff. So she will have very little idea of what it is.
So maybe it's not necessarily the child's worries and anxieties, it's the mum's worries and anxieties.
Yeah, I'd definitely say look after yourself. And I guess it really depends also on how your child separates from you. I think the only thing I would probably do is, it's a bit tricky at the moment with the lockdown and stuff, but what I always say is just getting your child confident and separating from you in, kind of not in a preschool, but like going somewhere and helping them kind of, not always being with them, sort of letting them go and explore a bit more independently, just to help them get comfortable with being in, slightly unfamiliar environments. And I always used to say for things like maybe soft play or something like that, and get them to a new soft play and be like, off you go.
So you mentioned lockdown then, and I've had like quite a few conversations with friends, and that first thing that they sort of brought up when I've said I'm going to be talking to you is, will 3 months of lockdown, where a child has spent all their time with just their mum and dad, is this going to have any long-term effects on them?
Yeah, I think what it really depends on is what the experience has been for them. So, obviously for some people, this time will have been really traumatic because they might have lost like a grandparent, or, like someone might have got ill in their family. And I think for those kids, it's like any other loss. It'll be a traumatic loss, and that will be almost regardless of the lockdown, really. I think it depends how their parents have been. I think us adults have been very different at how we have coped. I think it's been hard for all of us, but I think for some people it's been probably a bit easier than for others. So if your parents have really struggled, have maybe been worried that they're going to get it, like maybe they're shielding and stuff like that, there's been a lot of anxiety in the house. And I think living very intensely in a house with parents who are feeling, really worried all the time, probably will have an effect on kids. And regardless of their age, it'll teach them the world's a scary place, probably create some anxiety for them. But if you've been living in a house with parents, and I've got an only child, so we've been in the house, and we're introverts in many ways. So our lives have changed a bit, and we don't go out as much, but we've always done quite a lot in the house. So it's kind of not changed probably as much as it maybe has for other people. So yes, some bits of it has been difficult, and I'm sure she's bored to tears of seeing me all the time. But at the same time, I don't think it's been necessarily like bad or traumatic. And especially like we've done other things, we've learned other things, we've kind of done things like, cooking and baking, and like doing stuff like that really, and exploring the kinds of things that maybe she wouldn't get to explore in school. So that's probably been a positive thing. So I think it probably really depends. I don't think intrinsically you can say lockdown's definitely a bad experience, for everyone, and they'll all come out feeling worried, anxious and stressed out of it. I think this change into normal life will be tough, but some kids will have actually had quite a positive experience in lots of different ways, and will take that with them. Maybe like a sort of sense of, spending more time with their parents could be a really positive thing if they haven't been seeing them very much, and suddenly their parents are at home a bit more and kind of enjoying that family time could actually be really big for them. So I think it really depends on the family experience, because they will be really affected by how the parents have been.
What would you say to sort of any parents sat there now that are going, oh no, I've damaged my child forever now because I've had a really bad time through lockdown. What would you
I'd say first of all, get yourself okay. Because obviously lockdown, well, it's not continuing, but I know people are still not necessarily going out very much, are they? And I guess it's first you have to get yourself okay, because you can't really support your child when you're still feeling quite worried and anxious. And secondly, kind of be quite open with them and just explore explain to them what's happened for you, especially if they're a bit older and they can kind of understand that, you know, if they're sort of 5 upwards, and say, actually, I have found it really stressful. It's been difficult for me. And now I look back, I realise I was probably a bit more anxious than I needed to be. Did you notice that? And they'd probably say, yeah. Children are quite good at that. You can say to them, what did you notice? And they might say, well, you know, you're always snapping at me or whatever. And, you know, it's really hard to hear those things. But you can say, well, yeah, that's what people do when they're worried, and that's why I did it. So, and apologise if you were like really snapping all the time, and, you know, or whatever it was that you thought showed your anxiety. Say, I'm really sorry, but I feel better now. I've looked after myself. I've done what I need to do. Because I think for kids, it's understanding that you have looked after yourself. That's really important. That it's not their job to kind of make sure that you're okay.
I think it's really nice that you say that it is okay to apologise to your kids.
Yeah.
Because I don't know whether it's quite old school.
I mean, I think it's vital. I think that actually apologising to your children really teaches them those skills. First of all, it shows them how to deal with it when someone feels bad. So you've had a bad time. A, you reflect. B, you apologise for the things that went wrong, and you repair. And like learning to repair is a massive thing.
Yeah, definitely. So the last question I've actually got written down is a friend of mine that messaged in. She's got a 9-year-old boy, her friend Stacey. She says that there are so many different approaches to parenting, different theories, different styles of parenting. How do you know if you're doing the right one for your child?
Yeah, that's a question. I really loved it. It's kind of, I felt like saying, oh, can I borrow that? Because that is the whole reason I'm doing what I'm doing. I think, so kind of having done a lot of it, and also I guess in my clinical practice, what I see is the effect of parenting that maybe hasn't worked out very well. Obviously in combination with other things, but I see a lot of different families, and I can see, like, because I see a lot of teenagers, I sort of go back through time and listen to their lives, and I sort of understand how things have happened for them. And kind of combining that, so kind of real life experience with all the theories and whatever that come out. And also there's quite a lot of research around what works in parenting. There's some key things that are actually sort of common to a lot of the parenting stuff. That seems to make sense. So there is a lot of overlap, but I think if you only know kind of a few, you might not necessarily notice the overlap in the same way. Whereas obviously we've got quite a sort of broad top-down view, because we learn sort of different ways of thinking about things and looking from different angles. And actually you keep on coming across the same concepts really over and over again. And I think for me, that's kind of what's most interesting. That's what I'm working on is, I've called it the 4 essentials of balanced parenting. So I'm slightly obsessed with balance, and I think there's kind of balance in everything really, and finding a way of and it's an active process. Obviously, you'll tip to one side and then you'll tip yourself to the other side. It's just kind of what happens, isn't it?
Well, it's instinct, isn't it, if you're off balance, to bring yourself into balance.
And I think for me, it's finding this, kind of putting together those 4 things that I've just seen over and over and over and over again in different, you know, as I say, theories and practice, but also like what I see. So when we're trying to support teens to get better from, you know, very, very difficult experiences like neglect and abuse and other stuff that's happened, actually what do we have to do as clinicians in a way to reparent them, like what works for them, even in really difficult circumstances. So, and I don't think it's particularly hard when you know what those are. And there's lots of parenting stuff out there that's kind of a bit more extreme that I would really struggle to agree with as a clinician, because I've seen that happen in real life, and I've seen what kids are left with when they experience that kind of parenting.
Yeah, definitely. Can you sort of divulge what a particular type of parenting that you think is wrong?
I think for me, any kind of extremes really. So I think with the other part of the question was about what's right for your child, wasn't it? And it's definitely true that different children are different. So, for example, I know some parents are really very, very liberal with their children. You know, they really don't like setting boundaries at all. And it's just, you know, they just kind of abhor all of that boundary setting stuff, and they feel that kids should be free they should experiment with life, they should make their mistakes, and, you know, like, they should just do that. And I think there are some children who kind of naturally set their own boundaries, and that probably works okay, because they sort of have an internal way of kind of setting things for themselves. And those parents who do that, they're kind of very in sync with that child, because, you know, the child's able to set their own boundaries, they don't need to set them. It works quite well. But certainly, for, you know, most children will need boundaries, and they feel with boundaries, actually. Children who have no boundaries often feel really unsafe and terrified and can become really, really unwell. So I would really struggle with the idea that, you know, really no boundaries at all. Like, everything is free flow, everything happens as it happens. And then kind of as they get into teenagehood, having that similar approach to maybe things like drugs and alcohol, and feeling just need to experiment with everything and it's all good. Like, I really struggled with that. It is child dependent, but as a general concept, I think I'd be like, And the evidence certainly shows that having boundaries but freedom within those boundaries is what really works quite well. So you have an overall sort of set, but what they do within that is up to them.
Yeah. Almost like teach them the core belief, and how they then use that is the freedom.
But also kind of what you would not tolerate, really, like what would just absolutely be not okay, you know. A bit like what we're saying about, you know, dealing with 3-year-olds. You know, if you're saying that violence is not okay, for example, then, and that continues to your belief, then like that boundary is there. You know, that's really important. If they cross it, they know it. Whereas obviously, if people are feeling a bit more relaxed about it, they might not, you know, react to it in any particular way, or just sort of say, well, it's one of those things, or whatever, if the kids did become violent when they're a bit older. So yeah, I think something like that I would struggle with. And the other extreme I would struggle with as well, so kind of constant boundaries, everything very prescribed, really without any sort of sensitivity to the child. Some children do really well with strict boundaries, especially if they've got like autistic spectrum disorder and stuff. They do great with, you know, really strict boundaries and routines and rules. They really love that. But the majority of kids, that would probably be problematic to kind of a really great extent. So yeah, I'm just not a fan of extremes, I think.
Yeah, it's really interesting. What 3 things would you say are the absolute routine that has to be there?
That would kind of set. I mean, I think for me, whatever it is in the morning that happens, like the kind of the get up, get dressed or whatever, you know, like whatever the morning thing is for her. So get up, brush your teeth, have breakfast, get dressed. And I mean, if your daughter is getting to 7, then really you don't necessarily have to kind of implement it yourself. And like, especially if she quite likes routines, you know, like if she really sort of feels more comfortable with routines, then you could just set one up for her to follow, you know, if she's independent, for example, you know, getting dressed or something like that. And then you only have to like worry about the breakfast or whatever. So like, you know, set an alarm clock for a certain time, you have to get up, brush your teeth, get dressed. And she can do quite a lot of those things without necessarily needing your input.
Yeah, so that would keep her in her routine, but it doesn't necessarily mean
especially especially kind of if you've noticed that she seems to kind of be calmer with it, just reflect that and say, well, you know, I've noticed that you just seem a bit more like happy when we have things in a planned way, and you know that I you know, it's a bit tricky for me to do things in a planned way, but why don't you do your morning in a planned way, and we can, you know, you can write it up and draw it up, or you know, people like sometimes have like star charts or whatever, like just so that she knows she needs to do these 3 things before she comes down to breakfast, for example, or whatever it is. Because also, if she's going to want to do that, like if that's something going to work for her later in life, she might as well start practicing now.
Yeah,
because she will have to do that for herself when she is, you know, a teenager and getting into adulthood.
Well, this is it. I can't say that she likes it as such. I just know that when I have been, I suppose my mental health has been good, and I have been enforcing that routine, her behaviour is better.
Whenever you're kind of feeling like, okay, this week I feel like I'll be able to prioritise that, and actually every morning I'll prompt this routine, you know, so like you get it going. because you might just need to do like a really short sort of intense, right, you know, every morning this week I remind her what the 4 things are or whatever, and we do them on time. But then like the next week you kind of expect her to get on with it, maybe with like minimal prompting from you.
Yeah. Okay. Yeah.
Kind of having that morning, especially like preschool stuff, it's really good. I think evening meal and bedtime. I know people are really variable about bedtimes, and some kids go to bed at random times, especially in the summer when it's, you know, light all hours and whatever. It's something I've always been quite stringent with, because I think it just means there's enough sleep and before the school day, basically.
Yeah.
You know, whatever your daughter needs, that she's not staying up later, because obviously if she is tired, then it'll be harder for her the next day and all the rest of it. So I think, and generally we know that sleep patterns are so much better if they're kind of predictable and they happen at the same time. So yeah, I think maybe like whatever happens in the morning, evening meal and bedtime.
Evening meal and bedtime. Okay, that's a good starting point for me.
Well, I started it because obviously I work as a child psychiatrist anyway, and I have my own daughter, and I sort of thought, gosh, I've got all the stuff that I know from, you know, training, years and years of training, and I use it all on my daughter all the time. But for a lot of people, it's not really very accessible. Like obviously there's parenting books out there and stuff, but the stuff we have to learn is much more kind of advanced and variable, I guess, than maybe what you can just sort of pick off the shelf. And I wanted to create something where basically I brought the things that mattered together, like into something concise and easy to understand. So both sort of providing a bit of education, but also parent coaching type stuff, because I think when you have information, it's easier to be a better parent, isn't it? So, and easy to worry less as well. I think that's the other thing I think there's a lot of worry parents have, whereas actually when you know stuff, you don't worry quite so much. I've still not fully completed. It's almost completed. It's been like a labour of love over lockdown. I thought I'd have it finished by now, and then lockdown happened. So it's about teen mental health, and it's an online course. I mean, I've called it a course because most people seem to kind of know what a course is, but it's more about really helping parents who are worried about their teens, like are worried that their teens have some kind of mental health difficulty. And maybe they're thinking of going to the GP, or maybe they've been to the GP and the GP has sort of said, well, I probably kind of won't refer this on, but they're sort of still feeling like, you know, they'd want to know a bit more, and they're not quite kind of sure what's happening for their child or what they can do, like, or how to not make it worse for them, you know, like I think parents always struggle with that kind of thing. So in the course, basically I look at what's kind of normal for teens, like what's normal behaviour, and I go through some of the statistics around that actually that came out a couple of years ago for the UK kind of teens, you know, like how many do get mental health difficulties, how many are, I don't know, using drugs and alcohol and that kind of thing, what happens with social media use, you know, in teenage years, that sort of stuff. I look at why young people get mental health difficulties, so not just, you know, parenting stuff, but there's lots and lots of different factors, and I sort of go through how we as professionals think about why young people get mental health difficulties. I go through the kind of things that are red flags for us as professionals, like what would really worry us, and you know, why I would think maybe this is an illness rather than just, you know, your child becoming a teen and getting a bit grumpy and a bit more, you know, isolative and that kind of thing. And I go through 10 things you can do as a parent to kind of support their mental health regardless, really, so of what the diagnosis is going to be, so the kind of things that can really work to help bring your child out maybe of what's happening for them. And then I go for some very specific illnesses, so look at depression, anxiety, self-harm, eating disorders, drugs and alcohol use, and undiagnosed ASD. So kind of giving very specific like examples and going through like what might make you think about that. So I'll be launching that in July, but I'll be doing like a really low price for a pre-order for anyone who's interested as well. So yeah, I'd be very happy if anybody wanted to join that.